Right now on Up with KREM, getting a COVID-19 test in Spokane is kind of like pulling teeth. This morning, the newest requirements for getting a test and if the state plans on bringing a larger testing site back to Spokane.
And believe it or not, temperatures continue to drop this morning. We have parts of the inland northwest that are down at the freezing mark this morning. We're talking a chilly start to the day today.
Up with KREM begins now.
The Washington State Department of Health Secretary says state resources are spread thin after the latest briefing from the department. Dr. Umair Shah taking to Twitter to plead with Washington residents to get vaccinated. This morning, we're talking about how the surge is affecting our local resources. Good morning and thanks so much for joining us on Up with KREM. I'm Channing Curtis. Right now, Washington is seeing the highest rate of COVID-19 cases and hospitalizations since the beginning of the pandemic.
Our resource hospitals in places like the Tri-Cities and Wenatchee and Everett and Vancouver, as well as Seattle, all of them are going to incredible lengths to care for their patients. They are doing things like turning areas not meant to be taking care of critical care patients into ICUs.
Right now, nearly 1,600 patients are hospitalized with COVID-19 in Washington. That's the equivalent of 4 Harborview medical centers at capacity. State Health Secretary Dr. Shah says hospitals are experiencing extreme stress, but are not in crisis standards of care like Idaho.
So our goal is not to get there. This is largely preventable. This is about wearing masks. This is about getting vaccinated.
During Wednesday's briefing, officials said despite a number of cases among students, they're not seeing large outbreaks in schools. Now in Spokane, we're no different. Hospitals are reaching ICU capacity, and now local doctors are speaking out as well. Chief Medical Officer at Providence, Dr. Dan Getz, was clear that our hospitals have never been this stressed. He's now speaking out against people who say that getting vaccinated is a personal choice.
And I hear the argument over and over again that it's a personal decision, but I'll tell you, it's not a personal decision. Because if you require hospitalization and care, it's taking care away from that patient with cancer that's waiting to get that removed. It's taking care away from that patient that he needs their hip or their knee replaced. This impacts us all. It's a population health issue.
He also said there are 18 patients in Providence's ICU on ventilators, and not a single one is vaccinated. It's a frustrating fact for many physicians because they say that none of those patients would have been in the ICU if they were vaccinated. Now, other Spokane health officials are agreeing with his statement. KREM 2 was able to speak with several doctors yesterday, like Spokane Dr. John McCarthy, who works for the Native Project. McCarthy was also the former health officer of Okanogan County.
I can decide to go shoot people. That's a personal choice, but it's not a very good one.
Both doctors are questioning why the Spokane County in-state fair is still happening. So we reached out to each of the Spokane County commissioners, their offices, as well as the health district office and even interim health officer Dr. Frank Velasquez. Commissioner Josh Kearns did respond, saying that, quote, our community has had so many events taken from them over the last 18 months, end quote, and that the commissioners met with the Department of Health and the health district to make sure that the event was safe. He says that masks are required per the mandate. There are additional hand washing stations and even additional seating for social distancing. But doctors are saying that is not enough. Interim Health Officer Dr. Frank Velasquez stands by the decision to continue on with the fair. Now this morning we want to hear from you at home, as many doctors are saying they don't believe that getting the vaccine should be a personal choice due to the impact of unvaccinated COVID patients are having on our hospitals. We want to hear from you. Do you agree or disagree? You can vote right now on our Twitter poll and tell us what you think by texting us at 509-448-2000. We've already gotten several responses from you this morning. One person saying no, it should not be a personal choice. One other person, I absolutely agree. 100% love thy neighbor. Another person says getting a vaccination should not be mandated. I've been vaccinated, but I still believe it's a personal choice. Another person says, yes, it should always be a personal choice. Freedom in the USA. Lots of comments here. You can keep them coming all morning long. Again, you can always text us 509-448-2000, and that Twitter poll will be up all morning long, and we'll be keeping track of your comments. Now, if you've tried to find a COVID-19 test site recently, you've probably been hard-pressed to find any available appointments. And this just isn't just an issue here locally, but across our entire region. Nicole Hernandez is joining us live right now. She spoke with local health leaders about their plans for continuing to test for COVID-19 in our area. Good morning, Nicole.
Yeah, good morning, Channing. So right now I'm live at the Spokane Arena, and if you remember last year, this area right here was specifically a mass testing site for COVID-19. Now, of course, the arena is back to its normal functions here in the area, and people are having trouble finding COVID-19 tests that aren't completely booked out. So I was able to speak with the Spokane Regional Health District, and I asked them if they have any plans to start another mass testing site in the future. They said that SRHD is working with the Washington State Department of Health to try to set up a drive-through community test area. They're asking for that to happen ASAP, but SRHD doesn't know when or if that would happen. So we went straight to the source. The Department of Health says as of right now, they are not planning on opening up more free mass testing sites like the one at the Spokane Arena.
There are a number of tests now available to be done at home. You can pick those up in your local pharmacy. You can also order some of them online from online vendors. So those are rapid antigen tests that you self-administer at home, and that's a great resource for families to have on hand.
And the Department of Health says the federal government could be stepping in to help across the country. They do have some community-based testing sites across the state, and they're hoping to have more of that open up, but the whole system right now is really strained. So to help, we need to get COVID-19 cases down. That means as a community, we need to be getting vaccinated, wearing masks, and social distancing. So if you need a test right now during the shortage that we're seeing, the Spokane Regional Health District says if you need a test specifically because you have symptoms of COVID-19 or you are exposed to the virus, that you should be calling your doctor. But if you just need a test for an event or travel, that you should reach out to your local pharmacies or try those at-home tests. In Spokane, I'm Nicole Hernandez.
Now, we know we've given you a lot of information to process this morning. So if you would like more information or to read more about any of these stories, we're making it easy for you. All you have to do is text the word COVID to 509-448-2000. We'll send all of that information right to your phone. All right, time to take a look outside at the forecast because, man, it is a chilly one. And as someone who loves fall, I'm kind of feeling this weather, Jeremy. Like, yeah, it's a little chilly out. You might need to put on a coat, maybe like grab an extra cup of coffee to keep you warm, but it feels pretty good. It feels right. It's September. It's supposed to be a little chilly. Yeah. I like how you put your coffee mug up.
I actually just finished it. I was like, I'm going to drink. Oh. All right. Well, I'll just go fill it up. That's why we got a break room, right?
You can have all the coffee you want, Jeremy.
Actually, don't tell anyone, but here's what I do.
What?
I just grab the whole carafe. People are like, where's the coffee carafe? I'm like, I don't know. That's really odd.
Now we know. That's why we can never find coffee.
There's going to be a message from management. They're going to say, hey, please don't take the coffee carafe from the break room.
Please stop hogging all of the coffee.
And they're like, what are you guys talking about?
This is also how Jeremy gets more and more energized throughout the shows, throughout the morning.
Just gave it all away. All right. Well, hey. Let's just lean on this coffee carafe and talk about weather because we do have a lot going on. And this is a beautiful start to the day, but we've got a lack of wind. Notice the trees aren't moving and clear skies overhead. And that means radiative cooling. We're already seeing temperatures drop and drop in a big way. Deer Park, you're down to about 34 degrees right now. You move over towards Sandpoint, you're down at 35 degrees. You're in Newport. How about Newport sitting comfortably at 30? All around us, it's cool temperature. Oh, Deer Park hit 30. Oh, wow, it just updated right now. So a very chilly start to the day. For that reason, we have freeze warnings and frost advisories in place. This really just says, hey, if you have any sensitive plants, veggies, fruits, cover them. That's the way to do it. I have a neighbor with some beautiful flowers, and he was out putting sheets over all of them last night. I said, that man, hopefully he watched my forecast to know what to do. But, you know, sometimes people actually just pay attention on their own. But if you don't, hey, I got you covered. Clear skies overhead for much of the day today as temperatures climb. We go from the low 40s, even in the 30s in parts of town. It is in the 30s in parts of town. We're down to 35 at Fairchild Air Force Base. By this afternoon, temps in the upper 60s. It is going to be a little bit warmer, but still cool, even for this time of year.
There is a new COVID variant in the U.S. This morning, our Verified team talks with world health leaders on how it's different from the others.